everyone, this is Caitlin, and for my 10-minute final presentation, I'll be talking about healthcare associated infections, specifically central line associated bloodstream infections, otherwise known as CLABs. Contemporary evidence demonstrates that the top 3 most harmful events affecting hospitalized individuals include adverse drug events, HCAIs, and surgical complications. HCAIs, also known as healthcare-associated infections or nosocomial infections, are the type of infections that patients obtain during their admission at a hospital or other medical facility. These infections were not present prior to admission and are acquired during treatment. Generally, these types of infections appear 48 hours post-admission or up to 30 days post-discharge. According to the United States Center for Disease Control and Prevention, 1.7 million hospitalized individuals develop an HCAI while receiving healthcare treatment for a non-related issue every year. 1 in 17 die as a result. An HCAI can be acquired for multiple reasons. Cross-contamination between patients and healthcare workers can be an issue if hand washing or infection precautions are not followed adequately. Certain patients can be susceptible to common infections due to diminished immune responses, recent implants or prostheses, suffering from major trauma or acute renal failure, prolonged admissions, etc., etc. Many devices utilized in a hospital in order to treat patients can also open up the risk for infection. A prime example of this is the use of central lines, which can result in CLABs or central line associated bloodstream infections. First, we need to talk about what exactly is a central line. A central line, or central venous catheter, is a small tube that's inserted into a vein that typically leads to the heart. These 3 veins that are used generally are internal jugular, which is by the neck, common femoral, which is by the thigh/groin area, and subclavian, which is by the collarbone. They are used to deliver hypersomal solutions, dialysis, parenteral nutrition, or infuse multiple IV solutions or medications. Oftentimes, they're inserted into patients who are very ill and need long-term IV treatment, although reasons for placement can be broad and are solution-based. If you look up at the screen at the picture that I am demonstrating, it shows a really detailed visualization of what a central line looks like. Essentially, it kind of looks like an IV with a very tiny tube, and it's surgically implanted into the body, so you cannot see the remaining tube because it's in the vein. And there are 2 ports connected to it. Generally, there can be 3 sometimes. We also call these ports lumens, and these are what we connect syringes to, so we can do blood draws, insert medications, etc., etc. There's also, if you see those purple encasements, those are the clamps. So if we wanted to prevent infection or to stop any flow of medication, we could clamp it and nothing would get through. Compared to other hospital-acquired infections, CLABs have an incredibly high cost burden, costing an average $46,000 per reported incident. Additionally, studies indicate that CLABs lead to extended hospital admissions and increased mortality. Consequences of such infections depend on the type of organism the central line is infected with, along with underlying comorbidities, timeliness of treating the infection, and appropriateness of interventions. Regardless, though, current research indicates that CLABs are one of the main sources of bacteremia and septicemia in hospitalized demographics, which, to put those 2 terms into sort of layman, non-medical terms, those are both bloodstream infections that can lead to very devastating outcomes and can kill patients. Based on a litany of modern research, we have developed strategies to decrease the risk of infection when it comes to central lines. And a lot of these techniques are directed towards nurses because we are the type of people in the hospital who have the most patient interaction, and we interact with central lines the most. So a prime example of a technique that is really good at keeping everything aseptic and not harming the patient with an infection is sterile gloves. This is what it looks like. There's different brands out there, but this is just the one that I have. And we use these whenever we change a dressing, because a lot of times infections occur when there's cross-contaminations while changing a dressing. Now, sterile gloves are different than regular old clean latex gloves that you pull off the wall and that everybody uses. Sterile gloves carry a 100% guarantee that there are no germs inside this packaging. They are 100% clean. So basically what that means though is that they're for one-time use only. If I was to change a central line dressing right now, I'd put these on and I could not touch anything that was considered contaminant, not even the patient's skin. I would only be able to touch the central line itself or other sterile equipment. This is your number one protectant against infections with central lines. Another sterilized piece of equipment that we used is Tegaderm, which this is what it looks like. This is just one example of packaging. This is a transparent film that's placed over the central line. If you've ever been to the hospital and you've gotten an IV, this is the same type of material. This is also sterile, very aseptic. We put it on the central line, one, to keep the skin clean, but also two, because it is transparent so we can see and we can monitor infection. Another example of a technique that we've utilized in the hospital is we've actually created central line dressing kits. And this basically contains sterilized equipment that you need while changing a central line dressing, so you don't have to go and get other equipment. Everything's here at your beck and call, and it's all completely clean. So some examples of what's in this kit is, one, sterilized mask. When we change central line dressings, we wear a mask because by breathing onto the patient's skin, we increase the chance of germs spreading. So we always want to wear a mask. Second, sterilized tweezers. This again goes into the fact that when you're wearing sterile gloves, you cannot touch the patient's skin. So sterile gloves can touch a sterile tweezer, and we can pick the patient's gown, patient's central line ports if we need to move anything. Another really handy product that we have that decreases central line associated bloodstream infections is this. This is chlorhexidine. This is actually really cool. It's kind of like alcohol pads, but they're actually a lot cleaner and more efficient. Basically, you click these two wings, you shake it, the solution comes up and goes into this fuzzy side. And this can be used to clean patient's skin, clean the ports. If I was to show you an example, imagine this is a central line. This is the port, which, like I mentioned earlier, we would put a syringe in if we needed to get blood or infuse medication or whatever it is that we're doing. We could click this, get this part soaking wet with chlorhexidine, clean this part, and all down the visible parts of the tubing, and that kills germs, which is a really, really handy tool, much more efficient than soap and water or alcohol pads. Another important technique that I previously did not mention is hand washing. This is the most important skill that you can utilize in order to decrease the chance of a central line associated bloodstream infection or any other kind of infection in the hospital. It's vital. It's been proven to be effective. Everybody, including nurses and also including patients, should be washing their hands consistently. Currently, the CDC recommends that doctors and nurses wash their hands before and after every patient interaction, and this should 100% be followed. There's no reason not to wash your hands as a healthcare professional. A key element in learning how to prevent CLABS is actually learning how to spot an infection, because the quicker you spot an infection, the quicker it can be resolved. So let's talk about some signs and symptoms of infection. 1, fever. 2, chills. And 3, hypotension, which is defined as a BP or blood pressure that's less than 120/80. Some physical signs and symptoms that you can spot with your own eyes while looking at a central line is redness, pus or purulent drainage that is leaking from the site, edema, which is just a fancy word for swelling, and pain. If the patient is constantly complaining of pain around that site, then that is something to be very concerned about. A ultimate diagnosis of central line associated bloodstream infections is a blood culture, and management really depends on what kind of pathogen is infecting the central line, but usually antibiotics are prescribed. Also, further interventions and management depend on what kind of complications the infection may have caused. For example, it can cause osteomyelitis, which is a bone infection, or infective endocarditis, which is an infection of the heart. Really, management depends on how severe the case is. Ultimately, it's been proven by research that central line associated bloodstream infections are, for the most part, preventable, especially with proper surveillance and aseptic technique. And I hope that everybody walks away from this presentation knowing a little bit more about it, especially from a future nurse's perspective. And I hope that this presentation was informative and makes everybody a little bit more aware about why infections are so important to know about. Thank you.